Hello, this presentation is about Metropolis Health System and the new services that will be added. Metropolis Health System reduces hospital stays by offering comprehensive healthcare services that are accessible, cost-effective, and are tailored to the needs of the community. They have been able to reduce hospital stays because many of the services they offer are done to prevent illnesses. They have been successful by only having an increase of inpatient visits of 1,000 since 2010, and outpatient visits have increased by 50,000 every year. Metropolis Health System offers many different services. The Rehabilitation and Wellness Center offers outpatient physical therapy, return to work services, and cardiac and pulmonary rehabilitation, among other things. They also offer home health services, which include skilled care, therapy, and medical social services at home. They also have same-day surgery, which is able to eliminate the need for patients to have overnight stay. Other services that are offered at MHS include skilled nursing facility, which help patients to return to an independent lifestyle. This is also considered inpatient care. They also have a community health and wellness center in which educational outreach programs gives informative seminars on health issues such as diabetes, cancer, health awareness events, and Women's Health Resource Center. The Occupational Health Services works with over 100 businesses in the area to help reduce workplace injury costs. The last service is Recovery Services, which offer mental health services such as substance abuse help and individual and family counseling. The services that are provided by MHS are to provide quality, convenience, and affordable care. 5 new service areas that want to be offered in the following 5 years include ambulatory services, physical medicine and rehabilitative services, cardiovascular services, oncology services, and community health services. In my opinion, the 3 new services that should be started as soon as they are able to include ambulatory, physical medicine and rehabilitative, and cardiovascular services. The good thing is that ambulatory and physical medicine can be started sooner rather than later due to the fact that MHS already has some services that intertwine with these to help these services get up and running quicker. Ambulatory services are those medical services that are performed as an outpatient basis and do not include an admission to a hospital. They can include dialysis, x-rays, CT scans, colonoscopy, among others. These services can be provided in outpatient departments, physician offices, and surgical centers. With ambulatory care, there are financial pressures that can incentivize a provider to deliver care in a less costly environment. In ambulatory care, technology really comes out on top. People are able to connect with their doctors and other healthcare professionals through applications and digital interface. They do not have to physically come into the office, and providers can start billing for these services starting in 2019. Electronic health records allow providers to offer care connected through multiple sites, which in return lead to reduced repeated exams. Ambulatory care sites are less costly because they do not always need to be staffed with expensive personnel. Physical and rehabilitative services are for enhancing and restoring functional ability and quality of life to those patients who have had physical impairments and disabilities. People who recently had surgery, have chronic pain, were in an accident, or born with a disability would benefit from these services. Physicians practice in both inpatient and outpatient facilities since they have knowledge on musculoskeletal, neurological, rheumatological, and cardiovascular systems. This can increase revenue by offering services such as nerve conduction studies, ultrasound and fluoroscopy guided procedures, spine and joint injections, pain management and chronic pain, alternative medicines such as acupuncture, and prosthetics and orthotics. Cardiovascular services is the next service that should be offered. As heart disease continues to increase in the world and in the United States, it is essential to have specific cardiovascular services to offer, since cardiovascular disease also increases as population grows and people age. Deaths due to cardiovascular disease increased by 41% between 1990 and 2013 by climbing from 12.3 million to 17.3. Inpatient cardiovascular services include defibrillator implementation, cardiac catheterization, and coronary stent placement. Those are just 3 of the inpatient. There are definitely more. Outpatient services include EKG, EEG, cardioversion, and 24-hour monitoring. Inpatient stays can continue to be reduced if patients are able to come to ambulatory care and get simple things checked like their blood pressure and EKGs. There were different trend analyses when looking at the income statement, balance sheet, and cash flows and revenue statements provided by MHS. Out of the total assets, there was a total of $3,375,000 whose use was limited. These assets can be limited due to contracts with third outside parties. There was a total of $1,700,000 of income from operations with an operating revenue of $35 million and expenses of $34 million. $34 million is from patient service revenue. At the beginning of the year, there was $400,000, and MHS ended the current year with $1,150,000. This means that the company had an increase in revenue in the year. MHS also purchased $2 million in equipment, which can make it difficult for the company to buy new equipment and purchases this year. The total liabilities decreased from $12 million to $11 million in 1 year. The company was able to decrease their debt by exactly $1 million, which is a good sign. Expenses occurred from different services also saw changes. These numbers can increase or decrease with the new services that will be added. Nursing services decreased from $5,450,000 to $5,025,000. Physical therapy went from $695,000 to $700,000, and EKG and EEG went from $180,000 to $185,000. There are some possible obstacles when implementing new services. Looking at the patient revenue, it showed that this only increased by $600,000 in 1 year, which would continue increasing if there were more services to be offered. The hospital readmission reduction program means that CMS reduces payments for hospital readmissions for acute myocardial infarction, chronic obstructive pulmonary disease, heart failure, pneumonia, and coronary artery bypass graft surgery. If there are cardiovascular services, this means that people might get readmitted for the same heart condition and payments reduced. This can be somewhat overcome by using the ambulatory care to provide preventive diagnosis and treatment. With $2 million spent on equipment, it can be difficult for MHS to have money to buy new equipment. Since MHS already has a rehabilitation and wellness center, then physical medicine can use some of their equipment from there while new ones are obtained. Medicare patients and payments increased in 1 year, which means that there were more balances, which included deductible and co-insurances. This is especially true for inpatient stays and substance abuse. This can be troublesome for MHS if patients are not able to pay their balances. If patients do not have Medicaid or a third-party payer who would pay their deductible or co-insurance, the Metropolis health system would only receive 60% back of patient responsibility, which is known as bad debt. Bad debt only includes deductible and co-insurances, not services that were not covered. The good thing is that the billing department can work with patients to be able to make payment plans, which means that Metropolis would get the full 100% of deductible and co-insurances back. The admissions and billing department can also make sure that those patients who have Medicaid are enrolled in plans who work with us, or they can ask them to switch to a plan that covers their care. If MHS were to have more contract with insurances, they would be able to accept more patients and increase revenue even more. Patients who do not have insurances can set up self-pay options with the hospital if they want to take advantage of these services. Another obstacle can be global payment. This is a fixed prepayment that is made to a group of providers or a healthcare system that covers most or all of the patient's care during a specified time period. Patients who are seen for the same condition by another physician can fall under this. This means that MHS might not get paid. If patients receive their entire care by MHS, then this can be avoided and they would receive the whole fixed prepayment. Finally, adding new services to Metropolis Health System will definitely increase both outpatient and inpatient revenue. Laboratory services, CT scanner, medical and surgical supplies, operating rooms, physical therapy, EKG, EEG, and other services already bring in revenue, and this will increase with the new services that will be added. Last year, there was $600,000 left over, and number could decrease over a few months and pick up again once new equipment is paid off and more patients come to the hospital. Metropolis Health System had 34,000 physical therapy treatments last year, but this will continue to increase as more physicians are brought in for the physical and rehabilitative services that will be implemented. EKG services were 2,750. This will definitely increase when more EKGs will be done in ambulatory care and in the emergency room. Once the hospital finishes its renovation of the area they are having zoning issues with, they can use this area for new services. Starting ambulatory care can be easier since it's more cost-effective and doesn't necessarily need expensive staff. I definitely believe that oncology should be the next service that is provided after these three are implemented. Even though oncology services are expensive and there would have to be new equipment, medication, and proper staff, this will definitely increase Metropolis Health System's revenue even more. I hope this presentation gave you guys an insight into Metropolis Health System and why the new 3 services should be added. Thank you.